Okay. So again, we start by Fawzia sheet number 2. Okay. First question is 26 years old man, motorcycle, lost 1 liter, secondary to open fracture. Open fracture mean compound fracture. But if the bone is
Prof,
many segments, we call this
can't see the
comminuted.
screen, Prof.
Okay.
Prof, you can't see.
All right. Okay. Okay. All right.
Okay, can.
So, 26 years old man, motorcyclist, lose 1 liter of blood secondary to open fracture of the femur, sustained in RTA. Which one of the following is the earliest compensatory response to hypovolemic in this patient? Okay, so anyone? We have question like this before.
Baroreceptor.
Okay, baroreceptor increased vasoconstriction, so the answer is the A. So the first one. Second question is a 34 years old woman complain of distinct palpable lump in her right breast. Excision biopsy of the mass was done. Histopathology report show apocrine metaplasia. It is important to know that metaplasia in the breast is not precancerous condition. It is not like metaplasia occur in esophagus or metaplasia occur in the cervix. So it is important to know the difference. So in this condition, have papillary projection. What most likely pathological process? What is this?
Below this tumor.
Phylloidic tumor is a big tumor. It is also benign, can be, but it's just a simple, it is just a benign breast cyst. Okay. Phylloid tumor is fibroadenoma, and a huge fibroadenoma. In the past, we called it what's called cystosarcoma phylloide. This is a picture, I think, usually have a picture of phylloid tumor, usually big and mimic cancer, but it is not a cancer. Okay, we found an answer sheet. So it's just benign breast cyst or fibrocystic disease. Next question, 35 years old woman presented with recurrent peptic ulceration. So again, peptic ulcer if recurrent. This proton pump inhibitor previously received H. pylori eradication therapy 3 months ago. Which of the following is likely raise in the venous blood? I think this is repeated also question. So what is your answer?
Gastrin.
Gastrin. Okay, good. A 3 years old male boy presented with his mother with rectal blood loss. His mother describes a bright red in the toilet pan, no pain on defecation, with negative family history of the chronic disease. What is most likely? So it is not familial adenomatous polyposis. He is young. They have rectal blood. It is fresh blood. So what it could be?
Juvenile polyp.
So it is a juvenile polyp. This is also repeated question. Okay. 32 years old man presented with painful torticosis. Torticosis means that movement of the neck. Is no past medical history. His complaint it has been feeling rather tired over the last 4 nights. On examination, he has large rubbery mass in the lateral aspect of the neck. Rubbery mass, usually lymph node, and a few smaller mass along the internal jugular. So it is a lymph node. So this patient have some sort of lymphadenopathy. You correctly assume that the muscular neck spasm and the large mass are connected. So what is the most likely cause of this torticosis is due to pressure on. So this is anatomy question also. They have something movement or abnormal movement in neck. So this is abnormal movement is due to sternomastoid muscle. So which nerve is affected? Or which nerve is So the answer is a spinal accessory. Of course, a spinal accessory give 2 muscle. What is the 2 muscle given to spinal accessory?
Trapezius and sternocleidomastoid.
Trapezius and sternocleidomastoid. Okay, good. Okay. Next question is a 52 years old woman. Question number 6. And thin menopausal is diagnosed with breast cancer. Her menarche was age of 14 and her first child the age of 40. During lactation, she developed breast abscess and anesthetized surgical interventions. He has no family history of the cancer breast. So he just gave a scenario, but which is the following is most significant risk factor in this patient? What is the risk factor in this patient? He have many risk factor like menarche, like else. So what is the risk factor here?
Age at
Age
first
at
pregnancy.
Say again?
The age at the first pregnancy.
Yeah, the age of birth. So this is what we called it early primary gravita. So it increase the risk. Of course, early menarche also can increase the risk, but in this patient, because it's not mentioned in the answer, so it is the age of the first full-term baby or pregnancy. Next question. 30 years old woman is sent to outpatient clinic with a weight loss 5 kilo over the last 6 months. Also complain of anxiety, panic attack, palpitation. On examination, the swelling in anterior aspect move with the swallowing. So this is thyroid swelling. But this thyroid swelling have anxiety and palpitation. So the most likely diagnosis is
Graves'
Graves'
disease.
disease.
yeah, why? Yes, correct. But why is not Hashimoto? Because Hashimoto usually
Hypo,
they have
hypothyroidism.
Hashimoto can hypo and hyper, but usually is a tender swelling in the neck. Okay, so this is typical thyrotoxicosis or Graves' disease. Okay. 69 years old man has been admitted to HDU following anterior resection of the colon during general anesthesia. Is given 2 cm of intrathecal morphine. Of course, morphine is the important drug because we're supposed to have some question related to anesthesia, so the only related to us is morphine. On examination, they looking pale, drowsy, AB gases, ABS, arterial blood gases result are pH is low, BCO2 high, BO2 low, basic cis minus 2.1, glucose is very, very, very high. Lactic is high, which is sometimes with sepsis. So what is your diagnosis?
Respiratory acidosis. Sorry.
So this case
Yeah.
of respiratory acidosis, okay, this is respiratory acidosis because PCO2 is high also. Okay, respiratory acidosis. 32 old woman has a pigmented lesion excised in her left cuff. Histopathology diagnosed as melanoma. Of course, term melanoma mean malignant because the benign lesion is called nevus, which is complexly excised with 1 cm safety margin. Safety margin can be half cm, 1 cm is okay. What is the next appropriate management? This patient already have melanoma. They have excision with good safety margin. So what is the appropriate management after that, or what you need to learn as a patient or teach as a patient?
Education about skin self-examination and discharge.
Yeah, usually, of course, so we ask the patient to don't expose to the sun. If she like exposed to the sun because of his job, she need to put a cream or sun block or something like that because it is high risky to have the problem again. Next question, 60 years old man with a history of angina undergo uncomplicated operation for inguinal hernia. Post-operative is found to be hypotension, tachycardia, raised interjugular venous pressure. So what is most likely the cause of this hypotension? So this patient have something in the right side of the heart. So what happened to him?
Reduce
Some
preload.
reduce preload. Yes, reduce preload is correct, but it is also undergo uncomplicated. This is number 10. Reduce preload. ABC, reduce preload. Okay, I found the answer here is reduce stroke volume. So I just check it again. Okay, I check it again and tell you, but I think we have debate about this question. Is some answer it reduce preload, some answer it reduce stroke volume, but we decided to be the answer reduce the stroke volume. I will look to the explanation. I tell you next time.
I think because of the raised jugular venous pressure means as a preload congestion there.
Yeah, I agree with you, but I just forget why we answer it reduce the stroke volume. So I can consult some of anesthesia and tell you the answer. Okay, leave it to next time. By the way, I found in the most versions they write it's reduce preload, but our department of anesthesia answer it reduce stroke volume. This is why I just looking for explanation. Next question is about 4 years old boy presented to emergency with 2 days of fever, difficulty to walking, and he's unable to weight bearing on his right leg. He's been in oral amoxicillin. I think this we have this question before. 250 milligrams 3 times day, chest infection in the 5 day. His irritable temperature is high. He don't allow examination of his right hip flex and abducted. Blood test, white blood cells is high, CRP high, hemoglobin is normal. What is likely diagnosis? I think we answered septic arthritis. Next question about 34 years old man is admitted to emergency department with a heart injury. On examination, Glasgow scale is 9, which is low. CT scan of brain demonstrate extradural hemorrhage. What the following artery is likely the source of bleeding? So anyone?
Middle meningeal artery.
Yeah, middle meningeal artery arises from which artery? It arises from maxillary artery, and the maxillary artery is one of the two terminal branch of external carotid artery. Okay, and the pass to the skull through foramen spinosum. So it is important. Middle meningeal artery is important. Okay, I think this is about circle of Wales is another topics. Okay, 65 years old man has a history of TIA, transient ischemic attack. He is due to undergo a carotid endarterectomy. Carotid endarterectomy is common operation in UK, not common in other country. It is just to avoid further stroke. Which one of the following is true of internal carotid artery? So now we speak about internal carotid artery from anatomical point of view. So first, it is begin at the level of the sixth cervical is wrong, divided into anterior middle, correct, but not posterior because posterior cerebral is from basilar. Give ophthalmic artery is the correct answer. So the internal carotid have no branch in the neck, but in the skull he gave ophthalmic artery. He later gave anterior and the middle, but posterior cerebral, if you see here, is the posterior cerebral is from basilar artery. Okay, circle of Wells, and this is very important. 25 years old male athletic is training at rest. How many liter of blood pumped in per minute? How many his cardiac output? Anyone?
5 to 6.
5 to 6. So cardiac output is the same all over the body, whatever you are athletic or not. So it is 5 to 6. It's the same stroke volume. I think we remember this stroke volume also 70 milli. Of course, cardiac output is equal to stroke volume and the heart rate. Next question, a 26 years old man presented to emergency after sustained glass cut in his arm. On examination, 10 cm longitudinal laceration on the anterior aspect of upper arm. His symptoms suggest ulnar nerve injury. Of course, we have something called ulnar paradox and all these. On exploration, upper part of the arm, what you expected ulnar nerve to be? Okay, this is a funny question because if you remember the picture, that the ulnar nerve all over his way is middle side. So the ulnar nerve is medial. to the brachial artery all over his pathway. So his medial in the forearm, in the middle arm, it just disappear in the cubital fossa because it's become behind middle epicondyle. So usually it is medial to the brachial artery. It's different from what is called the
Median.
what other median
Median.
nerve. Yes, which is have lateral, then in front, then become medial. Okay, so ulnar nerve is all his way is a medial border. Next question is a 55 years old man presented with acute back pain following severe RTA. Neurological examination revealed lack of sensation in umbilicus and the flow. So again, dermatome is very, very important. So it is important to know the dermatome for umbilical level is which level?
10.
T10. Okay. And it is important to know that the level what we make the inguinal incision for hernia is T12 because usually inguinal incision is above the inguinal ligament about 1 inch. Next question, and it is tricky because it is common come nowadays, is a 65 years old man complain of being thirsty and getting up in the midnight to get toilet. His weight is 95.5, height is 165 meter or 1.65 inch, and the blood pressure is a little high, and oral hypoglycemic tolerance performed and produce the following. Fasting blood sugar 5.9, which is normal. 2-hour blood sugar is high. According to NH guidelines, the new guideline or definition of the disease, because they called it diagnosis according to NH guideline and definition of the disease. So what we consider this value, diabetes or impairing or normal or what?
Diabetes.
Yeah, nowadays we consider diabetic, even the fasting is normal, so they consider this patient is diabetic patient. This is maybe new regulation, maybe 2-3 days, years before. 9-year-old child with cellulitis in the hand, which a chronological sequence of immune globulin produced is correct. Of course, we have this question many times, like ID. Then you know that we have a cascade. So which immunoglobulin start first? In any immune response, what we start first? IgG, IgM, IgA, or which one?
IgM.
Yeah, followed by
IgG.
yeah. So usually in the in B humoral immunity, we start by IgM followed by IgA. Okay. 60 years old man presented emergency department with epistaxis. The source of the bleeding is identified in the little area and resolved with direct cautery. What the vessel is most likely responsible for bleeding? This also question have a lot of debate. So anyone give me the answer?
Anterior ethmoidal artery.
Anterior ethmoidal artery is correct. And also sphenopalatine artery is correct. So why we choose anterior ethmoidal, which is correct? If you see this picture, anterior ethmoidal is here and sphenopalatine is here. So both can be the cause of bleeding. But your answer is correct. So why your answer is correct? In other
Because
version, you can... Because what?
Because it resolved with direct cautery. So this is bleeding from the
All
anterior
right,
side.
good. Yes, because if you see anatomy, he says this is the nose. And they say, if they say in the question, what is the bleeding resources? So anterior ethmoidal is correct and sphenopalatine artery is correct. Both are correct. But this is anterior ethmoidal can stop by cautery. So how to stop the sphenopalatine artery bleeding? By
Backing.
posterior backing. Okay. So again, if you go to any sites or any other version of Fawzia, you can find some answers phenopalatine, some answer anterior rhomboidal. Both are correct, but anterior rhomboidal is the correct answer because he write resolved by direct cautery. If we remove resolved by direct cautery, what is the cause of bleeding? So anterior rhomboidal can, phenopalatine can. If I remove direct cautery and resolve it by posterior backing, so the answer becomes phenopalatine. So it is important to know we have the same statement, the same scenario, just some little change here. Okay? Who answered the anterior rhomboidal? You see this question before or not?
I learned this during my ENT posting.
Okay, yes, correct. Okay, this is why you have ENT experience. Okay. 70 years old man presented with esophageal reflux. Endoscopy confirmed presence of the hiatus hernia. But the question is anatomy. Esophageal pass through the diaphragm at the level of T. Anyone?
10.
Yes, again, as we mentioned before, esophageal hiatus or opening is important. Esophagus at T10, vena cava at level of T.
8.
8 and vena cava T12. Okay. This is important and easy because no debate on it. 78 years old woman with emphysema receives 60% oxygen by mask, has the following gas: pH is low, acidosis, BO2 low, BCO2 high, bicarbonate high, basal excess plus. So what this patient have?
Respiratory acidosis.
It is respiratory acidosis, but it is compensated or partially compensated or uncompensated or what?
Things partially
Yes, so it
compensated.
is, yes, it is partially compensated respiratory acidosis. Okay, 26 years old man having a stereostatic frame fitting the skull prior to the radiotherapy. You know, stereostatic, it is something now, we have something called gamma knife. This gamma knife used for give radiotherapy or go to access to the brain is something like this, but have 3 dimension. We put the data of the patient and put some pins to fix it. Sometimes they can fix it more and they can cause bleeding or injury, especially in some area of the skull which is thin. It is common use nowadays, especially in big hospital in neurosurgical unit. So on the cerebro abort arteriovenous malformation. 4. Ben secures the frame tightly through the scalp to the outer table of the skull, 2. Anterior to posterior. On insertion of one of posterior pins, the arterial hemorrhage is encountered. So this is pin to fix the skull, can injury branch in the posterior, so in the occipital area. So of course, it is which artery? It is easy. Posterior, so brain is occipital, so it is occipital, so it is occipital artery. 26 years old man presented with 2 months history of unilateral painless testicular swelling. So painless with cancer. Ultrasound show heterogeneous mass with testis with surrounding fluid. Again, it is secondary hydrocele. Blood tests show elevated alpha fetoprotein, which is the following most likely. So again, it is repeated. It is Yuxac tumor or teratoma. Next question, 24. A 2-day-old baby presented with increased respiratory distress. Is born at full term but normal vaginal delivery. On examination, he has cyanosis on the lower limb and the marked respiratory is drawing the chest. Femoral pulse is absent bilateral. He has been anuria for the last 2 hours. Pulse rate 140. Regular blood pressure low 60/30. Equal in both upper arm. So it is not coarctation of aorta. What is most likely diagnosis? So this patient is not followed because it's cyanosis, of course, but is not have pulmonary artery stenosis, but he have low blood pressure, something affects the lower limb, so something in aorta, and affect also the kidney, so become anuric, and not followed, and not coarctation of aorta. What it could be? It is the
Interrupted
same like, say again?
interrupted aortic arch.
Interrupted aortic arch. So they can give lower limb ischemia, can affect the blood flow to the kidney, and can make the patient cyanosis. Okay, of course, again, phallotetralogy, which is more common, affected associating with pulmonary stenosis. We discussed previous question about cyanosis and say this patient have cyanosis but improving crying, and what is our answer? Anyone remember the answer? If patient have cyanosis, improve by crying, what is the cause?
Bilateral coronal atresia.
Yeah,
Bilateral coronal
bilateral
atresia.
coronal atresia is very important and common question. 50 years old woman presented with a history of right upper quadrant pain, jaundice. She reported has urine become dark, so it is obstructive jaundice. A stool is offensive and difficult to flush. What's the following explain dark urine? Who now he asked about dark urine. Sometimes he ask about the staturia. So what is the cause of the dark urine? Is increase in?
Conjugated bilirubin.
Okay. All right. 50 years old woman with suffered a fall is found laying in the floor where she has been over 12 hours. Initial assessment shows she has a core temperature 28 degrees centigrade. What would expected early physiological response to low temperature? Of course, this is physiology question. If you have low temperature, what is the first response? Of course, we have some movement, we have increased metabolic activity, but the first sign is, of course, increased. Yes, so the first response is vasoconstriction. So increased constriction or vasoconstriction in peripheral blood vessels can increase metabolic rate. After that, shivering can increase thyroid activity, all, but the first one is vasoconstriction. 12 years old boy presented to emergency department 2 hours after helping his father in categories. He's complaining of rhinorrhea, itchy eyes, sneezing, blocked nose. His anorexia, hemoglobin is normal, white blood cell is normal, raised eosinophilia. Chest X-ray is clear. So the usually raised eosinophilia is with parasite and also with some allergic reaction. So in this patient, immunoglobulin in this allergic reaction is due to IG. Which one?
IgE.
IgE. Okay. 45 years old man presented with backache, leg pain due to prolapsed lumbar intervertebral disc. The pain is aggravated by coughing and sneezing, which is common in any spinal cord injury. Radiated to the dorsum of the foot. On examination, there is weakness of the dorsiflexion of the foot. So again, dorsiflexion of the foot or dorsiflexion of big toe. So what is the root of this dorsiflexion of the foot?
L5.
L5. Also the same for big toe extension, it is L5. If we mention plantar flexion, it is
S1.
S1. So plantar flexion S1, dorsiflexion S5. So again, dermatome, myotome is very, very, very important. Back to simple question. 75 years old woman has carcinoma upper rectum, undergo anterior resection. Arterial blood supply to the upper rectum arise from which of the following? So the question he asked is the superior rectal artery arise from which artery? Anyone?
Inferior mesenteric artery.
Inferior mesenteric artery. Okay, very common question. 65 years old man undergo abdominal aortogram. A stenosis is demonstrated in the lateral aortic branch, arise at the level of the body of the L2. The stenotic vessel is most likely to be. This is a very, very tricky question. What is your answer?
Second left lumbar artery.
Okay. All right. This is the correct answer. All right. So what is this is important? Okay. Of course, this is very rare, but it's important. If you take it in normal anatomy, we can speak about renal artery maybe at the lumbar one. But the second lumbar, sometimes it is can cause what we call it Adam-Wicks syndrome. Adam-Wicks, in some patient after aortic aneurysm surgery, they have paraplegia. And they blame the doctor. And actually, they don't need to blame the doctor. It is anomalies in the second lumbar artery. Okay, so this is anomalies if you obstruct the second lumbar. So it is can be in some patients the main blood supply of the spinal cord and can cause paraplegia after thoracoabdominal aortic repair. Okay, although it is rare, but in the centers which have a lot of the pulmonary or aortic aneurysm surgery, which is not in Malaysia or not in our country, so they have this problem. Maybe face it once per year or something. Patient after aortic surgery or aortic EVAR now, he developed paraplegia. So one of the complication in some patient is paraplegia. 50 years old man admitted to take surgery unit for left inguinal hernioplasty. Hernioplasty means insertion of mesh, which is a common to be done nowadays. On examination, he noticed that diffuse skin tanning, spotty pigmented in the elbow, nipple, buttock, pigmentation over previous abdominal scar. 3 hours after operation becomes very hypotensive and most likely cause. This is common in European country. If the patient, he says, suddenly I found I am become little darker. We don't see in the African country or Middle East country. So if you see the patient and tell you, I found my skin has become dark, what you expected the cause? And have some attack of hypotension. And he improved by cortisone. So what is your diagnosis?
Adrenal insufficiency.
Yeah, this is adrenal insufficiency or called the Addison disease or Addisonian crisis. Okay, so this is adrenal insufficiency. Of course, in other country, we don't have this complaint because we are little darker. But in European country, he found suddenly the patient say, I have become dark in color and have hypotensive attack. So put in your mind ACTH, adrenal insufficiency, because they have some effect in melanocyte stimulating hormone and they cause some pigmentation. 90 years old woman presented to emergency profound hypovolemic having fall from a horse. Posterior-anterior chest radiologists show a fracture of the middle third of the left clavicle. So fracture in the clavicle, middle third. Which of the following is likely to be damaged? So which artery or vein or structure related to the middle wall or the middle surface posterior to the left clavicle or to the clavicle? So we have any one of, like, for example, brachiocephalic, left axillary, common carotid, left subclavian, left vertebral artery. What is your answer?
Left subclavian.
Okay, so the artery or the vein, because we don't mention the vein, of course, the vein is more, but artery, okay, can. 65 years old man presented with painless right inguinal swelling. Cuff impulse is allocated and operation indirect hernia is raised. Which one of the following is cremasteric muscle is derived? Oh, this is proper anatomy question. Cremasteric muscle arise from which muscle? External, internal, transversus abdominis. What is your answer?
Internal oblique
Of course.
muscle.
Okay, of course we know external oblique muscle become external oblique aponeurosis, internal oblique become scaramesteric muscle, and transversus abdominis is become attached or related to fascia. So the answer is internal oblique muscle. 70 years old woman, recovery area, receives 60% oxygen by mask, blood gases pH low, BCO2 high, BO2 with a normal, reduced sensitivity of which receptor is responsible for this blood pressure. So this is a case of, again, is respiratory acidosis, and again is repeated question, and the answer is
Central chemoreceptor.
yes, correct. What is G receptor present? What is this G receptor? Anyone? G receptor is a stretch receptor in alveoli. Okay, it is lung stretch receptor. Okay, the same answer. We don't ask about it. Next question. 28 years old man presented with pain in the left scrotum due to varicocele. With vessel involved in varicocele. So left scrotum have a varicocele. So it is which vein?
Testicular vein.
Testicular vein, good. All right. Of course, the testicular vein left side end in which vein? Okay, right side, go to inferior vena cava, left side, left renal. Is important, and this is explain why it is common to have varicocele left side. Next question. 60 years old man is heavy smoker, presented with 10-day history of frank painless hematuria. Painless hematuria usually with a cancer, prostate slightly enlarged, his hemoglobin is normal, creatinine normal, PSA is normal. What is the most likely pathological? So this patient have painless hematuria and not benign prostatic, not cancer prostate. So what it could be?
Can be TCC, transitional cell carcinoma of the bladder.
Yeah, transitional cell carcinoma of the bladder. Of course, if we change this question and they become PSA is like 30 or 50 or 50, big, larger, so it is sure it is cancer prostate. Sometimes cancer prostate is not painless hematuria, so you must have a pain, urgency, frequency, all this. Okay, 34 years old woman presented with irregular mass right breast. Irregular mass firm is with cancer, malignant. After table assessment, her mother died of breast cancer at age of 58. Her grandmother died in ovarian cancer at age of 55. So what is the gene present?
BRCA1.
BRCA1. Okay. What is KRAS? Is it for which cancer?
Lung cancer.
No, KRAS is for adenocarcinoma and adenoma for the cancer colon. KRAS. B53 in any cancer. BTEN, it is in hamartoma, so which is not a tumor. MLH1 is for a Lynch syndrome. Lynch syndrome is a cancer colon and cancer uterus. So BRCA1 and 2 for ovary and the breast. MLH1 is for Lynch syndrome, which is cancer uterus and cancer colon. KRAS for adenoma of colon and the cancer colon. B53 for any tumor. B10, it is for hamartoma, which is not a tumor. Okay, of course, we don't ask about this, but just for your interest. Okay, we still have two questions. I stop after 40. So 65 old man presented with non-tender swelling right hemiscrotum during the operation. Hydrocele sac is open for 100 ml in the fluid is drained. So what is the anatomical structure surrounding this fluid? So he need to ask, is the patient have vaginal hydrocele? What is this layer is formed from?
Tunica vaginalis.
Tunica vaginalis. Okay, tunica vaginalis is not related to vagina. It is a covering because the testis is covered by tunica albuginea, which is color white, and the tunica vaginalis. Hydrocele can occur also in the female. We called it hydrocele of canal of nuke. Okay. 24 years old man is brought to emergency following RTA. His obvious airway compromised due to facial bone trauma, requires surgical airway. The surface landmark is localized. An optimum site for tracheostomy is incision is midway between suprasternal notch and anatomical position between suprasternal notch and
Laryngeal prominence.
no cricoid. Okay, so it is between cricoid and thyroid. Okay. Last question, 60 years old man has anterior resection of rectal carcinoma. Histological report indicated this Dukes stage B. Of course, you have Dukes A, B, C, and D. D, of course, liver met. A, superficial. If you say A is good prognosis, what mean by good prognosis? Means that is a 5-year survival is more than 90%. But D is bad prognosis, 5-year survival 25. So just simple, he asked about Dukes B. So it is not 100, not 90, but it's not bad. So what it could be?
70.
70. Okay. So it is 70. This is the last question for today. I stop here and see you next time. Okay. So next time.